It is very broad. There are many, many different types of headache disorders. Many of them can actually be disabling and quite debilitating. Our therapy session focused on two of the more common categories of debilitating headache disorders: migraine disorders and trigeminal autonomic cephalgias, which include cluster headache and some other rare forms of headaches. And these all tend to be fairly severe headaches, often can be debilitating, especially with cluster headache. They're much less common. People have heard of them because they're quite dramatic. With a cluster attack, they happen very suddenly. They're very, very intense, and they don't last very long. But during that time, it's extreme suffering for the person who's experiencing it. In addition to the pain, it's noticeable. One eye tends to get very red and tear and droop. That side of the face can start swelling. So they're very dramatic types of attacks. They tend to affect men a little bit more often than women, usually adults in early to middle and even into later adulthood. But they are quite rare. It's less than 1% of the population ever experiences cluster headaches. Migraine, on the other hand, is very common. 12% of all people have migraine. Most patients who come to the doctor complaining of a headache that's bad enough to warrant medical attention, most of those patients actually have migraine. And there are a few simple questions that you can ask a patient to determine whether you're likely dealing with migraine or maybe it's something else. With cluster headaches, you want to ask about these other sort of dramatic features I mentioned earlier, with physical changes in the appearance of the eye, turning red, getting droopy, having a lot of tearing. On that same side, the nose can run, the face can swell on that side, get red, puffy, and some other features can also accompany it. So those are the things you ask. In addition, patients having a cluster attack are very restless. They tend to want to pace around the room, even bang their head against the wall. In contrast to migraine, you may not be able to tell somebody is having a migraine, except that they may be holding their head a little bit. Not to say that they're any less debilitating, of course, but a patient with migraine needs to be very still and quiet in a dark place and just be left alone, because all these external stimuli tend to make a migraine attack even worse. You can pin the diagnosis of migraine if you ask these three questions. It's PIN, stands for three things. P is for photophobia, or being sensitive to light. I is for incapacity, and N is for nausea. These are three very common features in migraine, and if somebody answers yes to two or three of those, most likely that's what you're doing.